Hi, so now we'll start with the next topic in the sympathetic system, which is the adrenergic receptors. So we've already done in the last lecture, the previous one, we've done the neurotransmission of the sympathetic nervous system. And the major neurotransmitter, we know that it is the noradrenaline and it gets converted into the adrenal medulla into adrenaline. But otherwise, it is noradrenaline, which is formed in the neurons, right? So after it has now come out of the nerves, so it will act on here, you see the various receptors, whether it is the alpha 1, whether it is the beta receptors or the presynaptic alpha 2 receptors. Now we are going to study about these receptors, that where are these receptors present, that is the distribution of these receptors, and when you stimulate these receptors, what happens. So let's go and do them one by one. Now to start off, both the alpha as well as the beta receptors, they belong to G protein coupled receptor type of the group. So they all have a G protein coupled receptor. Now the alpha 1 is most of the time GQ type, alpha 2 is GI type, and all the betas are G stimulatory type, right? So this is the kind of the structure which these receptors have, and they have a G protein present with the alpha, beta and the gamma subunit. So this would be different. So this would be GS type, this can be GS type, this can be GI type, or this can be GQ type. So this is the difference, and then because this is different in these different receptors, the kind of the further what they activate, the various proteins, and further on, that is also different, and that gives them the different activity, so wherever they are present in the organs. So first we start with the alpha receptors. Now for the alpha receptors, I told you last time also that these two alpha receptors, their the position is different. So let's say this is the nerve ending, this is the neuron, and this is the organ ending, right? So the alpha 1 receptors are most of the times they are present here. This is the synapse here, you can say. So this is post synaptic, it's on the organ, on the effector organ, whatever organ is there. So alpha 1 receptors are mostly present here, while the alpha 2 receptors, they are present on this neuron, the neuron which is supplying the particular organ. So it is present here. Now what happens here, that they have noradrenaline as their neurotransmitter, and when the stimulus comes, okay, when the stimulus comes and there is depolarization and calcium ions, they enter, they will lead to the fusion of this vesicle with the presynaptic membrane, and they will cause the release of noradrenaline. Now noradrenaline can act on the alpha receptors. Here we are just talking about the alpha for the time being, or they can act on the alpha 2. Now the difference between them would be, because let's do the alpha 2 receptors are present presynaptically and they are GI type. So what they do is basically they are just like I've mentioned before, what are the presynaptic or the autoreceptors do. They are just like a lock on the door. So when they are present, they are locking the door, so nothing from inside can come outside. So noradrenaline release, if they are stimulated, there will be decrease in the release of noradrenaline. So whatever the effects of noradrenaline are going to be less if alpha 2 is stimulated, because it's a GI type. So if any drug blocks this, that means the lock is blocked, lock is open now, so anything from inside can come out. Okay? So that would mean that when you block the alpha 2 receptors, there is increase in the level of Na. So it has the opposite effect. Stimulation of these JOB receptors are present on the presynaptic terminal. When these kind of receptors they are stimulated, they cause decrease in the release of neurotransmitters, and when they are inhibited, they will cause increase in the release of the neurotransmitter and increase in the effect. So you'll see that the postsynaptic and the presynaptic, there will be difference in their effects. Now if they act on the alpha 1, then they'll cause whatever kind of effects they are supposed to cause in the organ system. So what are these effects by the alpha 1? And see, alpha 1 receptors, they are present. Firstly, we'll talk about their presence in the eye. So these dots, they represent the alpha 1 receptors, and these are the radial muscles of the eye. So when these receptors, they are stimulated, they cause contraction of the radial muscles. So they will cause contraction of the radial muscles. And when they contract like this, so this is like the, the pupil in the center, and यहाँ से इसको muscles they are pulling, and when they contract, वो ऐसे contract करते हैं, and this circle का size is going to be bigger. So when this contracts, this circle here, it is going to increase in size. ये ऐसे हो जाएगा. And this, what is the circle? It is nothing but the pupil. So when the muscles contract, it is causing increase in the size of the pupil. And increase in the size of pupil means it is causing mydriasis. It is causing mydriasis, increase in the size of the pupil. So these drugs or the drugs which directly act on the alpha 1 receptors and they cause increase in the size of pupil, this type of mydriasis is called as active mydriasis. This is called as active mydriasis. While on the other hand, if a drug blocks, on the other hand, यहाँ पे जो circular, these are the circular muscles, वहाँ पे we have the muscarinic receptors present. And if a drug blocks the muscarinic receptors, so let's say a drug will block the muscarinic receptors, then there's going to be unopposed action of the alpha 1. तो भी mydriasis होएगा. ठीक है? So if a drug blocks the muscarinic or anti-muscarinics which are blocking the effect of this drug, of the muscarinic effect, because muscarinic effect is going to lead to meiosis. When they contract like this. Radial muscles contract like this. Circular muscles contract like this, so they will cause meiosis. So when a drug blocks this muscarinic action, then only action left is of the alpha 1. Then also there is mydriasis, right? And that type of mydriasis, but it is called as passive mydriasis. So this is the difference between active and passive mydriasis. Active mydriasis is directly when alpha 1 is stimulated. Passive mydriasis is when the muscarinic receptors are inhibited. So again, these drugs are going to cause mydriasis. Now coming to the second organ structure that they supply, which is the urinary bladder. So we'll first concentrate only on the alpha receptors. They are present in the sphincters and in the trigone area, and when they are stimulated, again they cause contraction. So why are they causing contraction? Because जो GQ type of proteins होते हैं, when they are stimulated, they stimulate the enzyme phospholipase C, and ultimately what they do is जहाँ से IP3 and DAG बनता है, and both of them they lead to increase in the calcium ions, and that leads to the contraction. So when increase in the calcium would lead to the contraction, and all therefore the contraction is occurring in these particular tissue. So contraction if happens, so the sphincter is contracted, and the sphincter is contracted, it would lead to decrease in the voiding. It will be difficult to pass the urine if there is stimulation of the alpha 1 receptors. Now on the blood vessels they are present, again they are going to cause contraction of the smooth muscles. Right, so these are the alpha receptors present. So when they contract, what is going to happen? They are going to decrease the size here. Okay, so again this is the muscle, this is the blood, this is the lumen, and when they contract like this, they are going to decrease the size of the lumen. So they are going to cause vasoconstriction. They are very powerful vasoconstrictors. Okay, the lumen size is going to be now narrow. This is the effect on the blood vessels.